Okay, good evening everyone. Today we'll discuss about the atrial fibrillation. What is about this Ashman's phenomenon? Okay, so you see this is a classic ECG of an atrial fibrillation. So you can see there is no clear-cut P wave. These waves you cannot call as P waves. These waves you call as F waves. It means a fibrillatory waves. Okay, so what is basically a definition of atrial fibrillation? Atrial fibrillation is a supraventricular arrhythmia which is characterized by low amplitude baseline oscillations, which are also called F waves, along with an irregular ventricular rhythm, that is atrial fibrillation. Okay, so here the rhythm is irregular, you can see that very clearly, and also the baseline is not clear. You can see there is no clear cut P wave, but there are much high. But see, always don't get confused by seeing V1 that it's an atrial flutter. Okay, in V1 and in lead 2, always sometimes the fibrillatory waves will appear as a flutter waves. Okay, so don't get confused by looking at the lead V1. Okay, so now we will discuss here more about the Ashman's phenomenon. So what is Ashman's phenomenon? You see this bit. This is a bit of RBBB morphology, right? So what is Ashman's phenomenon is whenever there is a long short sequence. Okay, long short sequence means I'll draw and I'll show you. Suppose this is a QRS complex and this is a QRS complex. So whenever there is a long period and after that the beat following the longest RR, it ends with a RBBB morphology in a atrial fibrillation. So this is called a long short sequence. So whenever there is a long short sequence, it ends with a bundle branch type of morphology. See, you can see that very clearly here. See here there is a long sequence and after that this is a short sequence and this is a bit of RBBB morphology. Here also you can see this is a long short and this short ends with a RBB morphology. So why this is happening? So there is some criteria. So first I'll tell you what is the reason for this and then we'll discuss the criteria. Okay, so this is the, suppose if you see, this is the his bundle and this is the right bundle and this is the left bundle. Okay, his bundle won't be this long, I just drew for the explaining purpose. Okay, so what happens is, just remember that the refractory period of the his Purkinje system is proportional to the RR interval of the preceding beat. That you should remember here. So what happens is, so whenever there is a long short sequence, as I told, this is a first QRS and this second QRS. So here at this point the his bundle is totally refractory, right? So it has a long refractory period. So what happens, the next conducting beat which is coming from the above, from the atria. Okay, just remember the RBBB which I have shown here, don't confuse this with the VPC. Okay, this beat is arising from the supraventricular beat which is conducted aberrantly through the left bundle. Okay, so here what happens, whenever there is a long cycle after that, so immediately here one more atrial impulse came, that atrial impulse conducts down the his. Here what happened is, the right bundle has more refractory period than left bundle. Okay, so right bundle has more refractory period than the left bundle. So because of this, what happened, the impulse cannot go through here, it gets blocked here. Okay, so it conducts through the left bundle, giving an impression of a right bundle branch block. Okay, so you can see here exactly again, it there is a long cycle and after that at this point what happened, the right bundle is still in a refractory and the left bundle recovers little early. So that impulse which is coming from the atria is conducted through the left bundle and it gave an impression of a right bundle branch block. Okay, so this is basically Ashman phenomenon. And also remember that this need not be a single beat. Sometimes the right bundle may be more refractory and there may be a multiple couple of beats of Ashman's phenomenon. Like there may be some 5-6 beats of RBBB and again usual atrial fibrillation. So this was first described by Ashman. Okay, Ashman is a American physiologist. So there are some criteria called fish criteria for the Ashman's phenomenon. What is this? A relatively long cycle immediately preceding the cycle terminated by the aberrant QRS. This is what I explained. So suppose this is the QRS complex and again this is a QRS complex. So there is a long RR and this long RR is terminated by a incomplete RBBB type of pattern. Okay, so this is a long and short cycle. Okay, so that is the first point. Next point is what? The RBBB form aberrancy with normal orientation of initial QRS vector. A series of wide QRS supraventricular beats is possible. That is what I told. There may not be a single beat, but after that there may be again one more RBBB, again one more RBBB, so again one more RBBB. So there may be a series of Ashman beats here. Okay, that is possible. Next, a long short RR interval is even more likely to initiate an aberrancy. So this is important. What I am telling you, a long short initiates. So even if you see the previous ECG which we are describing here, there is a short cycle here between both these beats and there is a long cycle. Okay, and here again there is a short cycle which is ended by a RBBB type of beat. Okay, so that is what exactly we are describing. What they are telling is, if this long beat is preceded by a short interval, short RR interval, the likelihood of coming an Ashman beat is more. Okay, so a short RR interval is even more likely to initiate an aberration. Next, lack of a full compensatory pause. Here you cannot see a full, so this is not a VPC to give a compensatory pause. So this is just a supraventricular beat. So what happened after the supraventricular beat? Again, without any compensatory pause, usual one more beat came. Okay, so this is basically about the Ashman's phenomenon. So quickly we'll revise. There is something called fish criteria for Ashman's phenomenon. Ashman phenomenon is because the right bundle has more refractory period than the left bundle. So after a long RR, whenever there is a one more impulse coming from the above, see, always remember that the Ashman's beat is not a VPC, it's a supraventricular beat. Okay, so whenever there is impulse coming from above, it is blocked in the right bundle because the refractory period is more, so it conducts down the left bundle, giving an impression of a RBBB morphology. Okay, so that is basically an Ashman. There is something called a fish criteria which says that a relatively long cycle immediately preceding the cycle terminated by aberrant QRS complex, and also the series of beats are possible, and a long short is even more likely to initiate aberration, and there will be a lack of full compensatory pause. Okay, this is in brief about the Ashman phenomenon. Okay, so always whenever you see an atrial fibrillation ECG, just see whenever there is a long short sequence and there is any conduction of, there is any formation of any Ashman beats. Okay, thank you.